Hey everybody, this is Rob from Station 26 D Shift. I'm here with you today to talk about the administration of amiodarone using a metronome. So our patient today has VTAC with a pulse. He's stable enough to treat with medication as opposed to electricity. So our dose of amiodarone is going to be 150 milligrams over 10 minutes. So in order to accomplish that infusion, we're going to use some items from an IV drip kit. And the IV drip kit will be located on the orange tackle box on all the Anne Arundel County medic units. And the equipment that we're going to use today is a 20 drop set, a 100 cc bag of D5, a 60 cc syringe. We have a medication label, and we have a red blunt tip needle. So our first step is going to be injecting the 150 milligrams of amiodarone into the bag of D5. So the thing to keep in mind with amiodarone is that it's very unstable and it foams very easily. And when it foams, it actually makes the medication ineffective. So we want to handle it very gently, and we want to inject the amiodarone into the white port on the bag of D5. So even when we're injecting the medication, we want to make sure we do it very slowly because the turbulence can create foam as well. Once the medication is injected, we want to mix it very easily. Maybe invert it 1 or 2 times very slowly. And we want to make sure that we're mixing the medication in the bag before we prime the drip set. We want to make sure that the drip set is primed with medication as opposed to D5. So once the medication is mixed, we're going to go ahead and label it. So we have these medication labels here. And we're going to hang it right next to a liter bag of lactated ringers. So our lactated ringers will be infusing into an established IV on our patient at a KVO rate. And we're going to take our amiodarone and we're going to piggyback it into that system at the lowest port on the drop set, so the one that's closest to the patient. As the lactated ringers is infusing at a KVO rate, we want our amiodarone to infuse at 3.3 drops per second, which is going to be 200 drops per minute. So we'll turn our metronome on to 200 drops per minute, and we want to match the drip rate on the amiodarone to the metronome. The reason why we're going to piggyback all these infusions is because if we have any adverse reaction with the amiodarone and the patient becomes hypotensive, we want to be able to quickly transition to fluid resuscitation and turn off our amiodarone. So if our patient here becomes hypotensive, we have an adverse reaction, we're going to clamp off our amiodarone, we're going to disconnect that injection, and we're going to make this lactated ringers wide open to get as much fluid in as possible. Other than that, good luck in the field. If there are any further questions, contact your EMS supervisors, and everybody have a great day.